Okay, so today we're going to talk about blood gases, and I'm going to show you a few examples. If you feel like you need more examples, just post on Facebook or on the forum on the VHX site and let me know. So when we're talking about blood gases, we're talking about how acidotic or how alkaline the body is. Primarily, we see acidosis. That's going to be the most common thing, whether the patient is septic, whether their electrolytes are out of balance, or they're going into kidney failure. There's lots of things that can be going on behind a blood gas. So first, I'm going to just talk about how to analyze one. Some of you, this may be a refresher. Some of you, this may be brand new. And then we'll do a couple of examples, and I'll talk about those. Okay, so you always want to analyze the blood gas, and then you want to think about why is the blood gas the way it is, what could be some of the causes, and then as a nurse, what kinds of things am I going to expect for treatment? All right? So when we talk about blood gases, you have to know the normals. So the pH is 7.35 to 7.45. Carbon dioxide, or CO2, is the same as the ending of the pH, so that's easy to remember, 35 to 45. And remember, carbon dioxide is affected by breathing, and we're trying to blow off our CO2, okay? And then oxygen, or O2, should be 80 to 100. Oxygen is really treated separately, so you figure out your blood gas, you analyze it, and then you kind of do the oxygen at the end. So you have either an acidosis or an alkalosis, and then it's respiratory or metabolic, and then you figure out are they hypoxic or not, because sometimes the oxygen is okay, and everything else is out of whack. And then we have bicarb, which is HCO3, and that should be 22 to 26. Some books say 28. Remember, always follow up, use your textbook for class and your hospital policy if you're working in a hospital, but this is the general bicarb number, okay? So these are your normals, so you always have to know these. The next thing that you have to know is which one is acidotic and which one is alkaline, okay? So as a review for that, I'm going to do a different color, all right? So this side of the pH is acid, and this side is alkaline. This side of CO2 is alkaline, and this side is acid. I'm sorry, that's a little bit light. Let me see if I can. Okay? And then there's different levels of hypoxia, but pretty much less than this, we are lacking oxygen. Okay? And then bicarb, this is the acidotic side. This is the alkaline side. Remember that when you become acidotic, the kidneys hold on to bicarb to try to buffer all that acid in your body. Think about all the acid is kind of burning in your body and it's poisonous, and the bicarb is going to buffer it. So, for example, you have reflux, or you've eaten a fatty meal and you've got a lot of acid in your stomach and it's really upset and gurgly, and you take an antacid like Tums to kind of buffer that acid so it doesn't irritate the inside of your stomach. It's the same principle, okay? And then the reverse is true. If your body is too alkaline, then it gets rid of bicarb so that we can hold on and become a little bit more acidic, okay? So when we talk about bicarb, we're talking about metabolic. When we're talking about CO2, we're talking about respiratory, okay? That's very important for you to remember. So those are our normals. So when you're analyzing blood gases, you want to have this up somewhere, written on your paper somewhere, so that you can see it. Okay, if you're taking an exam, you want to write that down on your scratch paper, or if you're taking paper tests, you're going to want to write that down on your test so that you don't get mixed up. Okay, so a couple of examples, and I'm using the things that we see most commonly. So I'm going to give you an example of a pH of 7.25, a CO2 of 80, an O2 of 60, and a bicarb of 30. on the blood gas result, there's something called a base excess, and that is not something that you need to know at this point, but that basically means how far away are you from fixing the acidosis. So the bigger the base excess number, the harder it's going to be to restore your pH. Okay? So the oxygen in the middle is kind of funny because, like I said, we do that kind of separate, but this is how it's written on blood gas results, so it's kind of a good thing to look at it this way and analyze it this way. Okay? There are multiple methods. There's the tic-tac-toe grid, which I might make a video of later. Right now, I'm just going to show you the way that I know. Okay? So on all of these, we're going to figure out, is it acid or alkaline? So the pH here is acid. And we're looking at our diagram here, our reference here, to see if it's acidic or alkaline. The CO2 is acidic. We're going to come back to this, but we know it's low. And then the bicarb is 30, which is alkaline. Okay? Once you figure that part out, you figure what matches. So these two are both acid. CO2 is respiratory, so we have a respiratory acidosis. Okay, so what's happening here is CO2 is building up. You could have a COPD patient, or you can have a patient who is post-op, who is not awake enough yet from the anesthesia. You could have somebody who's received too many narcotics, very, very common, okay? And so their CO2 is building up. They're not taking deep breaths. They're not breathing fast enough, one or the other. And so they're building up their CO2. What happens when our CO2 builds up is we vasodilate, we don't perfuse, and it causes a depression of our neurologic system, and you basically will go to sleep until you die. So that's it's really important that we stay on top of this. So if you have a patient who has been receiving a lot of pain meds, or has just come from surgery, or is a COPDer, and they all of a sudden are becoming more and more sleepy, you want to see what is their CO2. Let's get a blood gas, because 9 times out of 10 that's the problem, and we're going to fix it. Okay? So the other thing that's happening here is the kidneys, which is the bicarb, also the metabolic system, is holding on to bicarb to try to buffer all that acid. So it's got a higher bicarb. Okay? So then comes the question of compensated, partially compensated, uncompensated, the part that all students hate, right? So the bottom line is, if your pH is normal, I'm going to write this down here. If your pH is normal, you are fully compensated, period. Or wholly compensated, however you want to put it, okay? If your pH is abnormal, okay, and nothing in the body is kicking in to help, so everything matches, you are uncompensated, completely uncompensated. If, as in our example, your pH is abnormal, but something is trying to help, okay, but they do not all match, you have a partial compensation. It makes sense, right? Your body is trying to fix it. It hasn't fixed it all the way, that's why your pH isn't normal, but it is trying, so it's partially compensated. It's not a horribly difficult concept, but in nursing school, we make everything more difficult, don't we? So we have an abnormal pH, so we are uncompensated, right? And the kidneys are trying to help because the bicarb is abnormal. They do not all match, okay? They do not all match. So we are partially We are partially compensated. Okay, we're partially compensated. We have an abnormal pH, and they do not all match. So if somebody was in renal failure, let's say, and their kidneys don't work, they can't kick in. So the bicarb is acidic. The kidneys can't help. Okay, we have an abnormal pH, and they all match. They all match. Okay, so that is uncompensated. Okay, so I have another example. Okay, so our next example, our pH is 7.36, our CO2 is 45, our oxygen is 70, and our bicarb is 25. So again, very methodically, step by step, pH is normal, but it's closer to the acidic side. So it looks like it could have been an acidosis. Okay, the CO2 is normal. The oxygen is a little bit low. The bicarb is normal, and it's a little bit closer to alkaline. This one's a little bit closer to acid, right? So the pH is normal. So we are fully compensated, period. No other questions, no what if or any of that stuff. pH is normal, we're fully compensated, okay? But it looks like these two match. We were in a respiratory acidosis, and our kidneys kicked in, and we're fixed. Now, whether we'll stay that way is a whole other thing, okay? So it's a fully compensated respiratory acidosis. One more example, and then I will take requests as you guys are studying if you need more assistance, or maybe you're a nurse working in the hospital or you're a student from clinic and you have a good example that you're trying to figure out. Post it in the comments, post it in the forum, email me, and I will make a quick video on how to analyze it. Okay, that's what I'm here for. So here's one more. pH of 7.30, CO2 of 30, O2 of 80, and a bicarb of 18. So again, methodically, the pH is acid. The CO2 is alkaline. The O2 is okay, and the bicarb is acid. These two match, so we have a metabolic acidosis because it is the bicarb, and the bicarb is metabolic, or the kidneys. Okay, so we have a metabolic acidosis. So metabolic acidosis often occurs with electrolyte problems. Let's say the patient has high potassium. Maybe they're going into renal failure. So that's a very common thing. And so we may be giving this patient a little bit of bicarb. We have to be careful. We don't want to interrupt the body's natural instinct to compensate. Could be other things as well, but this is pretty common. It could be sepsis, and the patient has an elevated lactic acid. Okay, so those are kind of the really common things that would cause a metabolic acidosis. Now, is it compensated, uncompensated? So the pH is abnormal, so it is not compensated. And the CO2 is going down. The patient's probably hyperventilating, blowing off their CO2, trying to help. These do not all match, okay? No match. So we are partially compensated. So I hope that helps, and I look forward to hearing from you. Thanks.